experiment. So the next experiment is hemoglobin test by Sahli's method. So here we will be taking into account the Sahli's method. The picture you can see is, this is a hemoglobinometer with different various parts, which I'll explain to you in the next slide. Before this, let us know what is hemoglobin. So hemoglobin is an iron-rich protein in red blood cells. Oxygen entering the lungs attaches to the hemoglobin in the blood, which carries it to the tissue in the body. When someone has insufficient red blood cells, or the ones they have do not work properly, the body is left short of oxygen it needs to function. This condition is called anemia. Each hemoglobin protein can carry 4 molecules of oxygen, which are delivered through the body by red blood cells. Every one of every one of the body's billions of cells needs oxygen to repair and maintain itself. Hemoglobin also plays a role in helping red blood cells obtain their disc-like shape, which helps them move easily through red blood cells. So they'll be easily moving through the blood vessels. Hemoglobin levels are measured by a blood test. Hemoglobin, or hemoglobin HB, which is the short form for hemoglobin, capital H small b, is usually expressed in grams per deciliter of blood. A low level of hemoglobin in the blood relates directly to a low level of oxygen. So before knowing what are the risk factors for high hemoglobin levels, low hemoglobin levels, let us first of all know how this particular experiment is performed. Before that, let us know what is the normal range of hemoglobin. So if you are a male and have the hemoglobin between 14 to 18 gram per deciliter, as I have told you, gram per deciliter is the unit to measure hemoglobin. So if you are a male and have the hemoglobin level between 14 to 18, your hemoglobin level comes under the normal range. Next, if you are a female and your hemoglobin level is between 12 to 16, again you are a normal range person. Then child 11 to 16, infant 10 to 15, and newborn 14 to 24. So these are the normal range of hemoglobin, and if your hemoglobin level comes below this, eat things which will help you to increase your hemoglobin level, or if you have a high hemoglobin level, get checked by the doctor, and whatever they prescribe, take that. Next, the equipments required are hemoglobinometer. So the hemoglobinometer, as I have told you, it has different components. Let us discuss these components one by one. So this is a hemoglobinometer pipette with 20 microliters. So you will be observing this particular part, which is the marking for 20 microliter. I'll tell you what is the importance of this marking later. So this is a bottle in which n by 10 HCl is filled. So n by 10 HCl, why it is required is, it get mixed with blood and form hematin, which is further compared with color strip of comparator box. So this is the comparator box I was talking about. So these are the color strip in the comparator box, which is compared with the hematin. So next, this is a hemoglobinometer tube where this mixing will be done. So, and it is graduated. The next thing is the glass rod or stirrer, which will help in mixing the blood with the n by 10 HCl or distilled water for that matter. Next, so how the procedure is performed. Let us know in brief that how you will perform this particular experiment. So with the help of a dropper, first of all, with the help of a dropper, fill n by 10 HCl in hemoglobinometer tube. And then as soon as you fill this particular n by 10 HCl into your hemoglobinometer tube, as I've told you, this is the hemoglobinometer tube. So it is graduated. You'll have to fill it to 2 gram percent. So there will be marking, and you'll have to fill the n by 10 HCl to 2 gram percent. Next, Put hemoglobinometer tube in the comparator box. So this is the hemoglobinometer tube. You have filled N by 10 HCl into it. Now put it in the comparator box. Now what you have to do is sterile your finger and then prick it. Let the ethanol dry and then later prick your finger to get a drop of blood. Next, with the help of hemoglobinometer, pipette suck the blood up to 20 microliter marking. So I've told you this 20 microliter is of importance, so you'll have to suck the blood up to 20 microliter marking. So as you can see, this is the thing, right? Next, now draw the blood in the hemoglobinometer tube. So you'll put back the blood in the hemoglobinometer tube now. See, this is the procedure you'll have to do. Next, mix contents thoroughly by glass rod and place the tube in the comparator box. Now, as I've told you, the glass rod, so mix this particular blood and the N by 10 HCl with the help of a glass rod and put it back in the comparator box. Next, wait for 10 minutes. During this time, hemoglobin is converted to acid hematin. So you'll have to give a bit time for N by 10 HCl and the blood you took to get mixed and form hematin. After 10 minutes, add distilled water drop by drop. Stir it with the glass rod till the color of the solution is same as that of the comparator box color strip. So the procedure will have to be done. Hematin has been formed within 10 minutes and now you'll have to dilute the blood so as to make it similar to the hematin, the comparator tubes in the hematin comparator box. When color of the solution is same as that of comparator box color strip, know the reading in hemoglobin gram percent. So there are this graduated tube has the marking. So in the gram percent part, you'll have to mark that marking. So this is how you will be taking your hemoglobin level. So there are various high hemoglobin levels and low hemoglobin levels. Let us discuss them. High hemoglobin levels could be indicative of the rare blood disease like polycythemia. It causes the blood to make too many red blood cells, causing the blood to be thicker than usual. This can lead to clots, heart attacks, and strokes. It is a serious lifelong condition that can be fatal if it is not treated. High hemoglobin can also be caused by dehydration, smoking, or living at high altitudes, or it can be linked to other conditions such as lung or heart diseases. Low hemoglobin levels. Low hemoglobin levels, this is the situation which many of us face. Low hemoglobin levels usually indicate that a person has anemia. There are several kinds of anemia. Iron deficiency anemia is the most common type. This is the form of anemia occurs when a person does not have enough iron in their body and it cannot make the hemoglobin it needs. Anemia is usually caused by blood loss but can also be due to poor absorption of iron. This can happen, for example, when someone has had gastric bypass surgery. Pregnancy related anemia is a kind of iron deficiency anemia which occurs because of pregnancy and childbirth require a significant amount of iron. Vitamin deficiency anemia happens when there are low levels of nutrients such as vitamin B12 or folic acid in the diet. These anemias change the shape of the red blood cells, which makes them less effective. Aplastic anemia is a disorder where blood forming stem cells in the bone marrow are attacked by immune system, resulting in fewer red blood cells. And hemolytic anemia can be the result of another condition or it can be inherited. It occurs when the red blood cells are broken up in the bloodstream or spleen. Lastly, the sickle cell anemia. Sickle cell anemia is an inherited condition where the hemoglobin protein is abnormal. It means the red blood cells are sickle shaped and rigid which stops the flowing through the small blood vessels. Anemia can also be caused by other conditions such as kidney disease and chemotherapy for cancer, which can also affect the body's ability to make red blood cells. Newborns have a temporary anemia when they are 6 to 8 weeks old. This occurs when they run out of the red blood cells they are born with, but their bodies have not made new red blood cells. This condition will not affect the baby adversely unless they are sick for some or the other reason. Babies can also have anemia from breaking down cells too quickly, which results in yellowing skin, a condition known as jaundice. This often occurs if mother and baby have incompatible blood types. So, there are some typical symptoms of low hemoglobin by which you can know that you have a low hemoglobin level and get yourself checked. So you'll be facing weakness, shortness of breath, dizziness, fast or irregular heartbeat, pounding in the ears, headache, cold hands and feet, pale or yellow skin, chest pain. So the people who are under the risk of getting the hemoglobin related disease are older people or people who lack iron in their diets can be at risk of developing anemia. People who do vigorous exercise are also at greater risk as exertion can lead to a breakdown of red blood cells in the bloodstream. Women who are menstruating or pregnant may also be at increased risk of developing anemia. People who have chronic health conditions, including autoimmune conditions, liver disease, thyroid disease, and inflammatory bowel disease, may have lower hemoglobin levels, which increases the chances of developing anemia. Hemoglobin levels increases in situations where a person needs more oxygen in their body. Consequently, someone who has lung or kidney disease, who smokes or is dehydrated may be at risk of increased hemoglobin levels. So, to overcome all this, there are some preventive measures to get a healthy lifestyle. While many types of anemia cannot be prevented, eating iron rich foods such as beef, dark green leafy vegetables, dried fruits, and nuts can prevent anemias caused by iron or vitamin deficiencies. Meat and dairy are good sources of vitamin B12, and folic acid is found in citrus juices, legumes, and fortified cereals. The American Society of Hematology recommended taking a daily multivitamin to help prevent nutritional anemia. Older adults, however, should not take iron supplements for iron deficiency anemia unless instructed to do so by their doctor. Smoking cessation and drinking plenty of water can help avoid high hemoglobin levels. So, various treatments to treat the anemia are anemia treatment varies depending on the cause of the condition. Changes in the diet or dietary supplements can help people who have iron or vitamin deficiency anemia. If the anemia is caused by another condition, treating the underlying disease will often alleviate the problem. Medication and blood transfusion are among the treatment options for aplastic anemia, and antibiotics may be used in case of hemolytic anemia. Polycythemia is a lifelong condition that has no cure but can be managed with medication. Sickle cell disease is a life limiting condition. The only cure available is a hematopoietic stem cell transplant. Treatments are available, however, that reduces symptoms and enhances a person's quality of life. So, these are various preventive measures and treatments regarding the hemoglobin levels. Hope you all got a better understanding of this particular experiment as well. And now I would like to thank everyone for joining this online course. Hope you all now know how these tests are performed. All of you will get your e-certificates through mail within a span of few days. Again, thank you everyone.